I'm Chris May. I own Coldwater Vision Center in Coldwater, Ashland, and Tishomingo, Mississippi, and we see a full scope of patients. And we implemented RightEye a few months ago, and as we have, it's really added a unique tool to our practice. It's allowed us to do some things that we've never been able to do before. The ability to assess is truly amazing. First of all, it's easy. It's one of those things we can move around the office. It wasn't something that was highly disruptive to our workflow or really steep learning curve at the beginning. We pretty quickly figured out how it worked. Our technicians understood how it worked. More importantly, our patients, as they're being tested, actually enjoy being tested. It's one of those things that's it's intuitive. It's not hard to go through. It's only a few minutes, and then the amount of data that we get back is truly amazing. Assessment is one thing, being able to figure out what's happening from a functional vision standpoint or from an eye-brain health standpoint or from a sports assessment standpoint, but then creating treatment plans and being able to show and educate, particularly educating parents. It's truly the most amazing thing I've had in a long time. Certainly from a functional vision system, probably the most interesting thing that we've been able to do from eye tracking that I've ever seen. Very cool and very small footprint, which has been nice also to being able to have something that kind of flows easily with us. From a practice building standpoint, what's been interesting is it helps us build a little more organically. So if we solve a problem or take care of a child, we grow the way we want to grow, which is by taking care of a patient, retaining that patient, but also their family and parents and siblings come in. So it distinguishes us from other practices, but also it grows us in the way that we want to grow by taking the best care of patients and retaining our absolute best patients, where we're not just having someone who says, yeah, I get my eyes checked. It's truly showing what we can do for them. Integrating RightEye into us was actually very simple. First of all, from a footprint standpoint, it's very small. It's battery powered and portable, so to the kids it's not intimidating. So adults do a good job with it because to them it's just playing a game, but kids love it. So as we move it up, they're able to take the system, it's tracking. Watching it being able to generate data is astonishing. The reports function, though, very easy to get through. So as our doctors were learning what we're able to see, you're able to look at it, and it's pretty quick to be able to go through the intuitive reports, but to be able to email that immediately to a parent. And so this conversation that happens, say, in the exam room, and then the details get a little fuzzy, it's able to reinforce that on the back end when they get back home. And then especially if there's a conversation happening between parents at home, it's even a greater reinforcement to be able to literally hit play and go, look, here's what was happening, and then look at what these eyes were doing, and there's a way that we're going to help it. So the education aspects of that are truly something that I have dreamed of for years. From a vision rehabilitation standpoint and for a neuroadaptive rehabilitation standpoint, one of the hardest things to do is to get buy-in and understanding, not just from patient but also from parent, to make sure that everybody's on board with the treatment plan and that we recognize a problem and are going to fix a problem. And so being able to really show the patient and their caretakers what's happening is absolutely revolutionary. One of the coolest factors that we've seen as we've used RightEye is the fact that it can be continuously updated. And it's not one of those things that we are having to update. The new functional vision report just came out just recently. And so all of a sudden it's just available on our device. We're able to do that. And instead of just working on tracking or brain health or sports vision, the functional vision really kind of is that more overarching report. It's really neat to see them just be able to reach out and have that be something where we can update, and software can change what we can do without having to buy an entire new piece of hardware or having to modify things or redo it. What they're able to do from a software standpoint is very impressive.